So immune checkpoints are really interesting, and this diagram shows the complex interaction between tumor cells and T cells. In brief sentences, what's going on is every tumor cell has this protein called MHC, and this can bind to something called a toll-like receptor, or TCR, on the suppressed T cell. And normally when you have this binding, this takes this suppressed T cell and activates it. And these T cells recognize, hey, there's something unusual happening in this cell. We must eliminate it. Now, your body has a safety checkpoint, and that's what this PD-1, PD-L1 interaction is. And this is what we call a negative regulator of this response. And so what happens is, in this diagram here, this tumor cell has an abnormal protein that is being detected by the T cell. But because there's this PD-1 ligand PD-1 interaction, this blocks that T cell from turning on, and it just sits there. It doesn't do anything. The way that immune checkpoint inhibitors work is they block this PD-1, PD-L1 interaction, allowing the T cell to become activated and therefore killing the tumor cell. Now, this is a little bit technical, but just as an aside, PD-L1 is a score that you may sometimes see on a report that an oncologist will order as part of a panel of biomarkers for your lung cancer assessment. On the left-hand side is what we call an H&E stain. This is historically how we used to look at lung cancer and determine site of origin and some important characteristics. PD-L1 is a specific kind of stain that a pathologist does, and they look at it under a microscope, and then they try to quantify the percentage of cancer cells that have this specific stain. And so you can see a report going from 0 to 100%. And this has direct implications when we think about how to strategically target populations who may or may not benefit from immune therapy.